Thank you, Brittany. Appreciate it. We're going to get started here. Thank you all for joining us. This will be a relatively brief webinar. Our goal here at the firm is to create a mini webinar series, one webinar for each individual guideline, and we'll have those shared on our website if you ever want to go back and revisit any of those. But I'll be talking about Guideline H today, which is drug involvement and substance misuse. Brittany, if you'd like to jump to the next slide. Just a really brief background on myself. I'm an attorney. I am a 28-year veteran of the Army and Army Reserve. I'm the chair of our firm's military and national security practice groups, and I'm the chair of the National Security Lawyers Association, which is a nonprofit that we recently launched a few years back, dedicated to training and assisting people in the security clearance community. As just a brief disclaimer, none of this is legal representation. I'm not talking as an attorney speaking with their client. I'm just sharing some information here, and I hope that everybody here learns maybe a little bit about Guideline H and some of the other things that we'll discuss here. If you do have any questions, feel free to reach out to our office or another attorney and start the process to get representation. Next slide, please. All right, so just quickly, our topics of discussion. I'll give a little bit of an overview and talk about the government's concerns, and then we'll talk about potential forms of mitigation, and finally we'll finish up with self-reporting and the importance of self-reporting. Next slide, Brittany. Okay, so this is taken right out of SEAD 4. You can find this on the internet if you want to search it, Google SEAD 4. So SEAD 4 lays out the 13 adjudicative guidelines. Guideline H is just one of the 13. So the government's concern here, and this is language that I've cut directly from SEAD 4. I'll read to it. There's another sentence at the end, or two sentences at the end that just add some definitions. But illegal use of controlled substances to include the misuse of prescription and non-prescription drugs, most commonly Adderall, and the use of other substances that cause physical and mental impairment or are used in a manner inconsistent with their intended purpose can raise questions about an individual's reliability and trustworthiness, both because such behavior may lead to physical and psychological impairment and because it raises concerns or questions about a person's ability or willingness to comply with laws, rules, and regulations. So two concerns wrapped up here in Guideline H. The first one is the state of mind that you might be in if you're impaired by drugs, whether it's physical or psychological. And the second is your refusal or apparent refusal or unwillingness to comply with the laws, rules, and regulations. And sometimes you can mitigate one or the other, and the judge might rule against you or the adjudicator might rule against you. Say, for example, they think you're not doing it enough to be physically or psychologically impaired, but that you're demonstrating an unwillingness to comply with laws or rules, they might rule against you just for that. Next slide, Brittany. All right, so here are, again, paraphrasing here, and I've shortened them up quite a bit, but if you go to SEAD 4, you can read a little more in detail about the potential disqualifying issues. For example, I removed the one that says use of an illegal drug while holding a security clearance. Well, they start with use of any substance misuse or testing positive for illegal drugs, things like that. So it really doesn't matter whether you hold a security clearance or not for the purposes of laying out the disqualifying issues. It is, however, tougher to mitigate if you hold a security clearance. But starting at the top, any substance misuse, so it could be anything. I've represented individuals in the past who have misused Adderall as a college student. A lot of people do, and they don't even realize that that's a guideline violation. If you take someone else's prescription medication, it's not your prescription. You've taken someone else's prescription medication. I know it sounds maybe a little crazy, but even Motrin 800s, if you are taking someone else's prescription medication, you are violating Guideline H. So you should not be misusing or using anyone else's prescription medication. Something like Adderall, Motrin, very easy to get your own prescription. So if you think you need those medications or someone thinks they need those medications, they should be going to their doctor and getting a prescription for them. But what we see quite often is college students who don't really anticipate applying for security clearance down the road use someone else's Adderall to help them study for an exam or something like that, which is, wasn't going on when I was in college, but it's very common now. So we've been able to mitigate that in most cases because of the circumstances, unique circumstances, long ago, things of that nature. We'll get into mitigation here in a little bit, but Adderall is a very common one. I've represented a couple people who have had addictions to cough medicine and the ingredients in cough medicine. I had one client a few years back who actually got kicked out of the military over this, and then worked in the civilian sector and got into a high-speed chase with police and crashed his vehicle, had cough medicine in his pocket and admitted it, and caused a whole bunch of problems for us. We won the case, believe it or not, in trial, but it was overturned on a written appeal to the board after the case. So very difficult case, but again, that one, nothing illegal. He was just buying cough medicine and using too much cough medicine and abusing it, just over-the-counter cough medication. Another one is testing positive for illegal drugs. This is very common with the military. Individuals who fail for marijuana or cocaine or something like that, they'll have two different problems to contend with. One of them is they're most likely going to be separated from that military branch. The other is they're going to try and maintain their security clearance regardless of whether they get separated from the military branch, because you're more valuable in the private sector, but it creates two different issues. So the big one, testing positive for illegal drugs. For those who aren't aware, there's been all this talk about marijuana being legalized. Marijuana is not legal. The federal government has never legalized marijuana. Marijuana is, as far as the federal government is concerned, is illegal. They just aren't taking action on the laws that are in place, and states who otherwise have policing powers are claiming to have legalized marijuana in their states. At some point, the federal government is probably going to legalize marijuana, but right now it is a Schedule I drug, which is, if you look at the actual schedule for drugs, marijuana is listed as one of the most serious, or at least appears to be one of the most serious drugs. When you look at the federal government schedule, obviously that's out of date and needs to be updated. But the reason it's a Schedule I drug is because the federal government has not recognized a medicinal purpose for marijuana, where other drugs that are, in my opinion, much more serious, like cocaine, aren't scheduled as high as marijuana because in the past there have been medical opinions that there is medicinal uses for those different types of medications. So that's why marijuana gets ranked so high, and that's why it's such a problem right now for individuals who want to own a firearm, who want to hold a security clearance. Can't do either of those things if you use marijuana. In the future, I think that they're going to figure out when and how to legalize marijuana, but they're just not in a hurry to do that because they haven't figured out how to regulate it as well yet as they do with other things like cigarettes and alcohol and things of that nature. So maybe if they figure that out and figure out how to make some more money off of it, they'll start, they'll legalize it and start regulating it. Down to the next bullet here. So possession, manufacturing, purchase, sale. Again, this is paraphrasing, but where people get in trouble here and they don't even know. I was talking to an individual last week at VetCon down in Albany that our firm puts on, and he is an owner of a large dispensary. He's also in the military. You can't buy and sell marijuana and hold a security clearance at the same time. So you can't own a dispensary, you can't manufacture marijuana, you can't purchase or sell marijuana, you can't use marijuana. You can't do any of that while holding a security clearance. So if you invest intentionally in stocks, in dispensaries and things of that nature, you are buying and selling marijuana, and that's how it will be treated, and you're at risk of losing your security clearance. So if you find out that you're involved in some type of investment that you didn't know had a portion of the investment dedicated to marijuana, then you should be fine. But if you are intentionally seeking out opportunities to invest, in other words, buy, sell, manufacture marijuana, you are committing a Guideline H violation and you'll likely have your security clearance stripped. Down to the next one, you have been diagnosed with a substance use disorder. So, that's some type of addiction. That would be difficult. That's a potentially disqualifying condition. So there are ways to mitigate, which we'll talk about here in a second. Failure to complete a treatment program. So you go into a treatment program, or you begin counseling, or you do something because you believe that you may have an issue and your doctor tells you may have an issue, but you don't follow the recommendations of the treating professional. You leave the program or you fail to comply with the program. That is potentially disqualifying and will likely result in you losing your security clearance. So if you end up in a program, counseling, rehab, anything like that, stick with the program and follow the recommendation of the treating professionals, because that is something that is going to be very important in any potential future litigation around your security clearance. And then finally, expressed intent to continue use. You guys would be surprised how many times I've come across this. So what happens is there's someone filling out an SF-86, an application for a security clearance, or an SF-85P for a public trust, and there's a question in there about whether you intend to continue using marijuana. And that person thinks that marijuana is legal because someone in their state told them it was. They think that they can list it because they're using it to treat headaches or pain or something like that, or anxiety, which is all recognized in the state, and it's probably prescribed by a doctor. Federal government doesn't care about that. So when they do their interview with their investigator, they'll list it on the form that they're going to continue to use it because they're using it as medication. Then they talk during the interview, they tell the investigator that they use it, it's prescribed, it's legal, I'm going to continue to use it. Well, the investigator writes all that down, and it's very difficult to overcome that or mitigate that in the future. So they want to see, which we'll talk about here in a minute, they want to see an actual expressed intent to not use marijuana or any other drug in the future. Brittany, next slide. So here are some potential forms of mitigation. Again, this is coming right out of Seed 4. You can find this yourself online if you care to look it up, but I'll just briefly explain each. So one of the best forms of mitigation is that the marijuana use or drug use, whatever the drug may be, was long ago, it was infrequent, it was under unique circumstances, such that it's unlikely to reoccur. So maybe while you were at college, or you were hanging around certain people that you no longer associate with, which, if you jump down to the next line there, the clearance holder has acknowledged their behavior and mistake and displays a pattern of abstinence. So that's where you have disassociated yourself from the individuals that you've used drugs with in the past. You're not living with people. That's a question that came through that we'll talk about here in a second. You're not living with people who are using drugs or possessing drugs in your home, because you're probably possessing them yourself if you fall into those circumstances. You've changed or avoided the environment that you were in when you were using drugs, and that you've signed a statement of intent, which is just a very basic, I don't ever intend to use drugs again in the future, and I acknowledge that my clearance will be revoked if I use any illegal drugs in the future. So that's a signed statement of intent. Again, this is all laid out, but I'm just kind of shortening them and then explaining them here. Next one, caused by a medical condition and the abuse has since ended. So think of, maybe somebody is harmed or has some type of medical condition where they have to take painkillers or some other type of medication that they become reliant on and then addicted to. Even though the medical condition has passed, those individuals often, you see this a lot with the military, the way the VA just forces drugs down veterans' throats. I know I had a knee surgery at the VA when I came off active duty this last time, and they mailed me 200 Loratabs because I refused them at the VA. I didn't even know you could do that, but they did it. So I'm not surprised why so many veterans get addicted, but this is a perfect example of a form of mitigation. Had I become addicted to those Loratabs, I would have argued, I didn't even want them, the VA forced them down my throat, and now I'm addicted to them. But I've stopped using them, I have a period of abstinence, there was unique circumstances, I'll make all these different arguments to maintain my clearance. And then finally, completion of a treatment program and favorable prognosis, which we talked about a little bit on the last slide. You want to stick with the treatment program and follow the doctor's recommendations. And then just some additional suggestions that aren't above or aren't in Seed 4. You want to get an expert evaluation. You want to have a doctor evaluate you, a counselor, someone you can sit down and talk with, and they can develop an expert evaluation, which is usually very favorable. Negative test results. So this is for drugs or alcohol. You can test for both. If it's an alcohol issue, which is a different guideline, you can do you can do a pattern of tests showing that you have a period of abstinence. But for drug, you can test urine, blood, hair, nails. There's plenty of different options. The more, the better, because you want to kind of dump as much evidence on the adjudicator as you can. Ongoing counseling or other alternative treatments like gym or some type of hobby. Maybe you hunt, maybe you, whatever it is, you started kayaking. Certain things that you would use to relieve the stress and get away, and you're no longer using the drugs as a result. Drug and alcohol awareness training. We use an online training that we have people complete that helps improve our chances of success. And then you would argue that if this is honest, you would argue that it was unintentional use or possession. So sometimes people will use a vape pen or use drugs. Sometimes your drink is spiked at a bar. There's a number of different ways that you could unintentionally use an illegal drug, so that's part of the mitigation as well. Next slide, Brittany. All right, this comes out of, well, not the self-reporting itself, but the policy for self-reporting is covered in Seed 3. Talks about all the different things that you would have to report. So just familiarize yourself with Seed 3, with your reporting requirements. If you have any questions, contact an attorney and they can talk you through whether it's reportable or not. But you'd have to look at reporting any drug use. You want to self-report it before you get confronted with those facts, because it's very difficult to mitigate those facts if you haven't self-reported them first. And then drug possession, you want to, if you discover that you're investing in something where you're buying, selling, manufacturing, you're doing those types of things, you should consider self-reporting so that you just kind of get the information out there, let the government know what actions you've taken to discontinue those types of things, and it puts you in a better spot, because if they catch you or they find this information later and they confront you with it, it's very difficult to mitigate. So always report in writing, and we talk about this all the time. You want to create a record and save that record so nobody can ever say that you didn't self-report. But it's also really important to report in writing, because you control the narrative. You get to provide proof, you get to build in mitigation, you get to do a whole bunch of different things that you wouldn't be able to do if you just got on the phone with somebody and told them that you use drugs. It would be a very negative conversation. But if you draft a well-written brief, a well-written self-report, which we do very often, we help people with those very often. If you do a really well-written work product and build in the mitigation, you have a much better chance of mitigating any potential risk of losing your clearance down the road. And then finally, just a note here, it's much tougher in most cases to overcome a Guideline E violation, which is an allegation that you have intentionally omitted information, than it is to overcome the Guideline H violation, which is that you've used drugs or you've misused a prescription medication or something like that. So, in other words, in most cases, we can mitigate the drug use. It's very difficult to mitigate lying about the drug use, because there's really no excuse for it, and it's very difficult to mitigate that, because it's almost always intentional or always intentional, and the adjudicators really don't have any patience for that type of violation. Next slide, Brittany. All right. I do have a couple of questions that came through that I'll just real briefly talk through here. So, can you regain a clearance after a Guideline H violation? You can. It's very common. We have a lot of individuals that we represent that some of them have even used drugs while holding a security clearance. That makes it a little tougher. It's easier if you have a lot of time between the drug use and when you reapply for the security clearance. If you have had your clearance revoked as a result of drug use, you have to wait a year from that revocation to reapply, and we would help you and draft a reapplication brief, or you could attempt to do it on your own. But you would do a reapplication brief and submit your new application for your security clearance. And again, it's just a little tougher to mitigate if that person was holding a security clearance during the period of drug use. Not impossible, we win those cases as well, but it's just not as easy to overcome. And then the second question we got is, if you live with someone with marijuana, are you at risk of losing your security clearance? You absolutely are. So you're living in a home, you're associating with someone who is manufacturing, cultivating, maybe buying and selling, using an illegal substance, and they're doing it under your roof. You live with them, it's in your property as well. So there's a chance that it would be alleged that you possess, manufacture, sell, use marijuana or whatever other drugs it might be. But it depends on the facts. There could possibly be some mitigating factors there, but most likely that would not be a case that you'd be able to successfully defend against, because you've got it in your own home. Just see if we had any other questions that come through. All right, not seeing any other questions. That's it. Thank you all for joining us. I hope that you learned something here. If you ever have any questions, I see a question coming through asking about domestic violence. It doesn't relate to drug use in any way, so that would be completely irrelevant. But if there's anything, if the person who lived there somehow didn't know about the marijuana use, I don't see how that would happen. You're living under the same roof. If you didn't know about the marijuana growing or marijuana purchase or sale or use, then you could probably argue that as mitigation, but it'd be very difficult to. All right, so as I said, this is just one of the webinars in our series. So we'd like to invite you to stay tuned. Next up is Guideline I believe Yep, so Guideline I is coming up next, which is psychological conditions. So that will be, I believe, in the next week or two. So stay tuned, and we hope to see you at the next one. Thank you.